shouldn't blame patients for being overweight. The National Institute for Health and Care Excellence has published new guidance for doctors. It's draft guidance encouraging them to monitor their tone so they don't stigmatise people. But with obesity levels rising, can health professionals afford to take a softly approach? Professor Mike Kelly is director of the Centre for Public Health at NICE, and Fatima Parker campaigns on issues to do with size acceptance and is herself overweight. Good afternoon to both of you.
Good afternoon.
Good afternoon.
A GP, no matter what they're talking about, should always be polite and respectful, shouldn't they? Is this patronising to GPs, telling them how to handle giving someone the information of you need to lose weight?
Yeah, it certainly is. And what we're trying to do here is ensure that when people are in a consultation with a GP or any other health service staff that they might come in contact with, that there's an acknowledgement, first of all, that how difficult it can be to lose weight, how difficult it can be to maintain that weight loss once it's happened, and that it's pretty unhelpful just to focus on, pull yourself together, you're overweight, that kind of thing. So a sensitive approach is the good approach. It's the approach that many GPs use in any case. But we do want to reinforce the message that it's something that should be handled properly and sensitively.
What's been your experience, Fatima?
I think this is a good point. I'm really pleased, and I see a positive move from my experience. I've had almost 40 years of stigma. And it's not related to health at all, but just because you're fat, it's badly seen. So changing the tone and probably treating the patient for what they come for and not giving them health, diet and weight loss advice when it's not even necessary, it's important.
But we do know, don't we, Fatima, that in the same way that had somebody, and I'm sure this happened many times, in the 60s and 70s, went into the GP whilst, smoking on a cigarette, we now know, and many doctors will have told people over the years, even if they came in to talk about something else, they'd say, can I just check, do you smoke or don't you? And I've been asked that question. And, when you say no, they say, great. If I'd said yes, I guess there would have been a conversation that flowed from that. We know that being overweight has its dangers.
It's a general idea, and it's something that has been going on and on and on, and science hasn't proved that it's a case for everyone who is so-called overweight, according to BMI, that they are diseased. I know that the doctors should look after patients' health, but they know from the tests, and they know from their patients' ailments and visits what they suffer from. If they have a very bad, health style, or the way they live is they do not eat properly, or they don't know, or they deliberately don't want to follow a healthy lifestyle. They'll advise them on that.
Professor Mike Kelly, on that point, that overweight doesn't always mean unhealthy.
Well, what the science shows us is that for each pound that you put on above what would be considered a healthy BMI for your height, then the risks associated with that increase. And they increase exponentially. And the risks that increase are for coronary heart disease, stroke, hypertension, osteoarthritis, type 2 diabetes, and cancer, particularly cancer of the breast and the kidney. So bringing down the weight and holding the weight in question reduces the risk. It is correct, I think, to say that it's not a disease in itself to be fat. That's true. But it is a risk factor for a range of other things. And these things are technically preventable. So, it's important that we work on them.
Thank you very much. I'm afraid we've run out of time, Fatima, but thank you for talking to us. Fatima Parker, who campaigns on issues to do with size acceptance, and thanks as well to Professor Mike Kelly, who's director of the Centre for Public Health at NICE. That's it from me. Have a great afternoon. Richard is up next.